Hi, my name is Craig Guttroff. I'm a physical therapist here at Phenomenal Rehab, and I'm here to talk about bulging discs. I've had a lot of patients, they get panicky, they get worried. Oh my gosh, my doctor has told me I had a bulging disc. I'm probably going to have surgery. That's usually not the case. So I'm here to explain what exactly is a bulging disc and what your options are. So we're going to look at this lovely spine here to explain what a bulging disc is. Here I'd like you to take a look at, here's a healthy disc. And these are basically the padding between the bones, and also for shock absorption between the bones and absorb the weight of the body. Here, if we turn slightly to the side, you'll see here's an actual bulging disc. And what happens is when people have pain, the bulging disc actually is pushing on the little nerve here, and that causes pain wherever it goes. And we're gonna have my lovely camera guy zoom in here. Whoa, the magic of camera work there. We've blown up the spine here for you to take a look at so we can better explain what a normal bulging disc is and one that's going to cause you pain. What people don't realize, if I was going to take the general population and I did an MRI on them, that's a test of imagery so I could see whether they had a bulging disc or not, over 25 to 30% of the general population would have a bulging disc at any given time but say that they have no back pain whatsoever. How is that possible, you ask? So if you look right here, we actually have two bulging discs. This disc here has a bulge in the back. This one would actually cause pain because it pushes on the nerve. Nerves are like electrical wires in your house. It doesn't matter where the switch goes on, wherever that nerve goes, that's where you're going to have pain. Over here we have another bulging disc, but this bulging disc isn't hitting any of the wiring in your house or wiring in your back, so it's not touching a nerve. So therefore, this one would not cause you any pain. This would be one that would go undetected, or basically you'd have a bulging disc and not know it. So what can you do? There's a lot of options. Don't always think surgery is your first option. Matter of fact, most orthopedic surgeons will recommend you try more conservative measures first rather than jump right to a surgery if you need to. Now that's always a valuable option for certain individuals if it affects your quality of life and you tried all the conservative measures, but more than likely you can try physical therapy. And what we're going to do in physical therapy, we're going to find ways to try and suck that disc back in, because the disc can actually heal itself, and when it heals, it'll often heal stronger than it was before. And again, we're talking very minute, very small space here, so we don't actually have to have that disc go very far in before we relieve your pain. So if you ever have any questions about a bulging disc, don't worry, just try Phenomenal Rehab for your physical therapy needs.